Good morning. We'll just give a few seconds. I see everybody's coming in right now. And once we get most of you in here, I'll get started. Good morning. Thank you, everybody, and welcome. We're so glad you're here. Let me start us on the first slide instead of the last. Let's see here. All right. So again, thanks for being here. This is number 5 of our Healthy Building series. And today we have Keith Hustak with Spectrum Health. He is going to help us to prepare our buildings and workspaces for our new normal. And be sure to catch all of our recordings and our prior webinars that can be found on our USGBC COVID-19 page. I'm Sherry Holman. I'm the Executive Director, coming to you from on my remote office on my deck, and hopefully we won't have any odd noises. I thought since it was such a beautiful day, I'd love to come to you in this way. So we'll see how it goes. I already hear a chainsaw in the background. So anyway, thanks for being here, and thank you to Keith. Looking forward to your presentation, and I'm going to stop sharing my screen now and let you share yours.
Great. Can you guys hear me, first of all?
I don't think that they can talk, so we'll have to assume that they can. But I did want to say one other thing is you guys can put questions up in the Q&A, and after Keith is done presenting, we will get to those questions, and we'll have plenty of time for that towards the end.
Okay, great. And it sounds like, or it looks like maybe Morgan can help us. It says the host disabled participant screen sharing. Is there a way you can unlock that?
I'm going to make you the host, and hopefully that will solve it.
Okay, there you go.
Perfect.
Hopefully you see my slides.
We do.
Okay, very good. 1 second. Okay, how's that go? Good?
Perfect.
Okay, well, thank you, Sherry, for that introduction. And I think I know I'm in this office here, and I'd much rather be there in the woods, it looks like, with you, of course, socially distancing. But again, thank you for having me. My name is Keith Hustak. I serve as Vice President of APP Services and of Operations for Spectrum Health. The title of my presentation is Prepare, Restore, and Thrive. And I want to start by saying this, especially for those of you who are in West Michigan. You know, in the early days of COVID, West Michigan, really proud because West Michigan was here for us, the health system, in terms of, you know, providing us with hand sanitizers and masks and, you know, social distancing and actually shutting down your businesses, which I know is hard. The economic and the anxiety strife that you guys must be feeling, I can only imagine because we feel it here too at Spectrum. But what that allowed for us to do is actually learn about this disease, learn how to treat it. And so thank you. You've done your part, and now it's our time to do our part, which is to get you guys back to work and get you back to work safely. I'm going to go through some slides, and I'm going to show you what we call our employer guide, which I think is what everybody is kind of be interested in. But here's some kind of basic facts, slides for you about COVID-19. Okay, first things first is what is COVID-19? And I like to start with this slide because there's a lot of myths out there, and basically, you know, COVID-19 I want to start with this. It's a disease that is new to us, right? And that's important for a lot of reasons. Because it's new to us, we don't have a cure for it. We don't have a vaccine for it. We don't have immunity to it. So that means that it's more contagious and more deadly than what we typically see with flu. So you can see that on the slide there. And that's because we've never been exposed to a virus like this. And so when that happens, our bodies are really susceptible to not only getting infected, but then a serious infection. What kind of symptoms does it cause? It causes, of course, cough, fever, shortness of breath. Those are like the main symptoms, if you will. And then there's minor symptoms like headache and sore throat and runny nose, et cetera. And that makes it challenging too, right? Because people this time of year, you know, you look at Sherry's backyard there who have allergies, you know, may have a runny nose and they're thinking to themselves, do I have COVID or do I just have normal allergies? And those are things that we are fielding every single day. The last thing I want to point out is this resembles the pandemic of the Spanish flu. And if you look at kind of the history of the Spanish flu, there was kind of an initial surge, and then there was a flattening, and then there was a second surge. And I think that's important to point out because it's something that we are certainly mindful of. But again, thank you all for doing your part. We flattened the curve, and here, let's get back into work. But here's some top things to know. These are recent things that have happened. I always kind of start my slides with when I'm talking about this topic. About a week and a half ago, some new symptoms came out from the CDC, aside from the ones I just mentioned in that first slide, that includes loss of smell and taste. So we were seeing that, and it's been studied a little bit, and they added that then to the list of symptoms that I mentioned earlier. Also, we're noticing in our health systems that it's causing a hypercoagulable state. So Keith, what does hypercoagulable state mean? That means that you are more prone to blood clots. So if you think about how this disease affects us, what it typically does is it will, imagine your lungs being a sponge, and it creates, and then you put that sponge in a bucket of water, right? What happens? The sponge absorbs that water, and that's what this disease does, essentially. It causes your lungs to be very wet, very heavy, and very stiff. Because of that, you are bedridden usually for multiple days at a time, which already puts you at increased risk for blood clots. But this disease, for some reason, is causing even a higher risk of blood clots than what we see in typical respiratory disease of this nature. So it's just something that we're monitoring all the time. Other things to know, we have expanded our testing capabilities. So in the early days of this, and by the way, my COVID job, aside from all those things that I do, my COVID job is I run the testing tents here at Spectrum. In the early days of this, we were doing roughly 100 tests a day. We had no testing capabilities. We had no supplies. We were doing as much as we could, saving those supplies for some of our essential physicians and APPs and nurses. But now we're doing 1,000 a day, and we want to get up to 4,000 a day. So we have the capability as of last week to do 4,000 tests per day. And so that's why we want to open it up to you, our business, our economy. Let's get our economy going now that we've flattened that curve. And so testing is a big part of that, right? You can see on there we have a hotline. The hotline is open right now. It's 8 to 5, Monday through Friday. But very shortly next week, it'll be open 6 a.m. to 6 p.m. And so we're really excited about having that ability. You can do anything from, if you need someone to get tested, if you have questions, please call that hotline. Face mask and social distancing reminder. So as we are opening up, and I think even just a couple minutes ago, my colleague and I were in here, we're talking about the Governor Whitmer in her press conference, and she's opening up, right? And people are talking about relaxing all the rules. And what I want to say is this: I don't want you to think about this as relaxing the rules. What I want you to think about, though, is that we can open up in a different way that can keep everybody safe. And so just because we're opening up, the northern part of the state of Michigan, or certain businesses like manufacturing companies are opening up, I still say that hand washing, face masks, social distancing is still the key to keeping this disease at bay. And then last thing I'll say for top things to know is ethnic and racial disparities. So what we know about this disease is it does affect people of brown and black color more than it does someone like me who is a white male. So just be wary of that. If you have employees in your place of business that are of Hispanic or African American descent, you may want to consider doing things different with them, maybe isolating them more if you can, maybe having them come in early before the shift starts, that sort of thing. So those are my top things to know as of this point with COVID. Here's some statistics. You can't get a healthcare provider up here without talking about statistics. So you can see here, we have close to 5 million cases from a national perspective. We know it started in China, right? But you can see how quickly this thing has spread just in 6 months or so. Now here's the Michigan data, and I want to point out some things that are interesting about this Michigan data. You can see the clusters there on the east side of the state, right? Now, why is that? Well, of course, on the east side of the state, it's more congested, more populated. Remember, I just talked about social distancing and how important that is. So it makes sense that Detroit, which by the way is where I trained, so huge lover of everything Detroit, but Detroit, where they have the international travel coming in, certainly has the biggest number of cases. But here on the west side, we also are seeing, of course, a large hotspot there in Kent County, but it's not near what Detroit is. And what I'll say is, although our numbers continue to go up, they are at least flattening a little bit, and we feel good about that. You can see we have 53,000 total confirmed, just over 5,000 total deaths from COVID. Remember that COVID is more contagious and is more deadly than the regular flu. And then 28,000 recovered, which is obviously my favorite stat of this slide. This is a great slide I like to show. So on March 24th, we were using something called the Penn-Chime model. This is a model that I think all healthcare institutions were probably using. I think the Trump administration was using it, and it was showing us basically what happens if we don't do any social distancing, right? And you can see on this that, actually it's funny, today is May 21st, right? On this date, if we had done nothing, so nothing at all, no social distancing, not closing down businesses, today was the day that we were gonna have to start choosing who lives and who dies. And I say that with all sincerity because that was what was happening. We were in meetings to discuss the criteria for who was going to live and who was going to die. All health systems were doing this. I know that Henry Ford, some things leaked out from them, but it's the truth. We were reaching that. So that green line there is the capacity of what we had, and it would have skyrocketed where we would have lost a lot of lives there. But again, thanks to social distancing, thanks to all of you, we've avoided that. We have flattened that curve, which is great. This is a quick thing I'd like to show that we're in the blue level, the blue zone. This is kind of our plan for how we look at surge. And this blue zone here is, means that we're operating below normal levels. We do have the slide there, the ED triage tents. Actually, we're bringing those down. And the reason for that is we're not seeing the volumes of people that we were seeing in the EDs anymore. However, from a testing capability, we are continuing to scale up our tests. So I work at 1300 Michigan, which is downtown Grand Rapids. And again, going from 1,000 to 4,000 tests daily. Let's get into testing really quickly. And then I want to show you guys the playbook, and then we'll open it up for question and answer. So, testing capabilities. There are essentially three main types of tests. The first is that we have the PCR test, and that's kind of the gold standard, it's called. The nasal pharyngeal test is another term for it. And this is a test that you have to have a nurse perform, and the nurse will take a Q-tip and she will stick it into your nostril and go way in the back of your nose. It's not an easy test to go through. It's somewhat invasive. If you have a nasal polyp or if you're on blood thinners, We typically then don't do this test on people like you because, again, it's very invasive. It can cause nosebleeds. But it still is the most reliable test that we have. And so that's the test that we're doing, again, 400 tests a day. We then have the Nares test. And the Nares test is something that we utilize in just the anterior nostril, not going all the way back. Actually, with this test, you yourself can self-administer the test. That's the good thing about it, right? So imagine you're at home eventually, and you have this little testing kit, and you could actually self-administer it. The Nares test is less sensitive than the PCR test. So you lose about 8 to 10% sensitivity, but we think there's an avenue for it when it comes to people who are asymptomatic and need to get tested. Not going through that very invasive test, being able to self-swab by the way, you need a healthcare witness. So healthcare witness just means that somebody has to watch you that, yes, this specimen did in fact come from your nostril. The third test is the rapid test. And the rapid test, there's been a lot of controversy about the rapid test. Is it, as sensitive? I think there was a stat out there that it's only catching about 40% of the cases, I think is what I heard. And what I'll tell you is that's all false. The rapid test is very sensitive. It's very specific for COVID. We feel really good about it. The rapid test gets you results within 15 minutes. By the way, the results we get on these other two tests, the nasal pharyngeal and the Nares test, takes about 24 hours to get results back. The rapid test, 15 minutes. It's a great test. The problem with it is we don't have a very large supply of those rapid tests. So we, right now in our health system, are reserving those rapid tests for our patients, right? So you think about, they come into the hospital and we have to determine very quickly which floor do they go on. Do they go on the COVID floor or the non-COVID floor? And that's why we have to reserve those rapid tests for that particular patient. I talked to you about the testing tent that I run. The last test I want to talk about a little bit, because I know it will come up, and then we'll move on to the playbook, is serology testing or antibody testing. This has been a big one in the news as of late. I know there's a lot of independent labs that are trying to sell people on antibody testing. And here is our stance from a spectrum perspective. Antibody testing will do a great job of telling you if you've had COVID. At this point, it is not doing a great job of telling us if you have an antibody to COVID, or meaning if you're immune to COVID. It's going to take a lot more testing for us to feel good about antibody testing, to make sure it's the right test to tell us if you have antibodies or not. So if you're asking me, I would not put all of my faith and spend a lot of money right now for you, the employer, in antibody testing. And I hope that makes sense, because you're not really going to get a big return for your buck on that. A couple other things I'll mention about testing. Right now, our test for the Nares test is about $85 per test. So a lot of employers are utilizing this test from us when they want to see, when they're returning to work, right? They want to see what is the baseline health of our employees. We're using it kind of in that capacity, but then also a contact tracing capacity, which I'll get to here in a little bit. Okay, I'm going to switch over here. So I'm going to escape out of this, and then I'm going to go to our playbook. Okay. So this is our employer guide. I hope you can see it. Sherry, can you just give me a nod? Okay, thank you. Very good. Thank you very much. Okay, so this is our playbook. I also call it our employer guide. And a couple things I just want to kind of thumb through it. So remember I talked about the fact that you guys were here for us in the beginning, and now it's our turn to be here for you. This employer guide is a free service. So a couple things that we've done. We have this employer guide, number one. It's free. It teaches you everything from what to think of before you bring your employees back, what cleaning solution you should be thinking about, how to properly glove and mask. It has different checklists in it. How do you welcome employees back? And then all types of resources for you in terms of PPE. What is PPE? Personal protective equipment. You'll hear PPE a lot, and that just means the mask, the gloves, face shields, that sort of thing. This employer guide has everything in there for you. Has a ton of links to the CDC website. And the good thing about this, as things change, we will update this player guide. So it will be sent to Sherry, who will then send it out to all of you in a link, basically. And that link will be updated. So that way, it's a little better to do it that way from a version control perspective. Okay, very first thing it talks about is all of our resources. So we have our COVID hotline, which you can see here. And let me blow this up a little bit so you can see it better. Hopefully that's better for you, all of you. You can see it has our employer hotline there. And by the way, there's two hotlines, right? There's the COVID hotline, but for you guys, we wanted to set up a separate employer hotline. What does that employer hotline do? That employer hotline allows you to kind of bypass a lot of the mass testing protocols that we have, that we can get you guys in and tested sooner than others. Also, if you have any questions for us, we're here to answer those questions. We also have the employer resource webpage and the symptom checker. What is the symptom checker? Also a free service for you. It's also part of our playbook. The symptom checker basically is where you self-attest online, basically, or on your phone, if you have symptoms to COVID or not. And it runs you through an algorithm. And if you have no symptoms, you get a green check. And that lets your employer know that, hey, I'm self-attesting, employee, to you, the employer, that I don't have any COVID symptoms and I can work. Great tool that we're using. Okay. I can keep going here. Getting prepared. I talk about this all the time. You have to prepare. Okay, so a big part of the employer guide is preparing before your employees come to work. You can't have them come to work and then you start doing all your social distancing protocols and cleaning solution, right? We recommend 2 weeks prior that you're getting together with some of your key employees. You're working on all your protocols, what cleaning solutions. You're doing a deep clean at that point. I visited a company yesterday where they had all those protocols in place. Now, they've been back to work for a good month or so, but I was really impressed. They had a screening checker in the front door. They had X marks that marked where employees could stand and work. Really impressed with what they've done, and they utilized an early version of this playbook essentially. You can see here we have planning checklists for you. Again, you're not, it's not like you have to do all this on your own. We have all the things in here, all the tools and tricks and tips for you. And if there's ever a question, again, you can call our hotline. Keeping socially distanced, of course, is big. Cleaning your work facility, I just talked about that, also big. Let's talk about masks. So I'm going to say something controversial, and then I'm going to tell you what our stance on it is. If you look at the literature, masks in and of themselves have not been statistically proven to prevent disease, okay? Now, you're thinking to yourself, well, why in the heck am I being required to wear a mask? It's because in this particular disease, it's a respiratory droplet disease, which means that you cough, and when you cough, the respiratory droplets pull the virus down and land on your surfaces, right? By the way, this disease is not hard to kill. Like hepatitis, for example, is a virus that's very hard to kill. HIV is not hard to kill, believe it or not, outside the body. This virus also is easy to kill. It's not that hard. It doesn't really live outside the body for that long. But what we do a lot of is that's why we have all those cleaning protocols in place, which again is in the playbook. But what masks do is if you were to cough, it will catch a lot of that respiratory droplet that will come out, right? That's number one. Number two is masks actually remind us of the times. So when you see a person with a mask, maybe it's becoming more normal now, but I'm still like, I'm reminded of what era we're in, right? I'm not wearing a mask now, but if I go out to the store, I put a mask on and everybody has masks on, it reminds me, oh yeah, socially distance, stay away from people, washing my hands, etc. And that's the benefit to masks, and that's why we're using them, essentially. Next, let's talk about gloves. Gloves is another one that I love to talk about because gloves, unlike masks, are something that we are used to wearing, right? We're in Michigan. We wear gloves all winter, and then a lot of you in your businesses, you have employees who need to wear gloves to protect their hands, right? Be careful with gloves. That's my warning. Gloves will provide a false sense of security for you. And I'll give the example of I was basically in the grocery store, and this old lady was she was wearing gloves, I think, to protect herself. I think she probably felt like, I'm older, I'm higher risk, and she had gloves on, and she's touching all the food, and then putting them in the cart, touching her cart then with the gloves. She then touched the screen with the pad, and I wasn't I wasn't following her, but I was following the social distancing and the lines, right? So I happened to be kind of marching along with her this entire time going through the store. I then followed her out as I checked out, and I saw her get in her car with her gloves still on and was touching her car, right? So she just brought all that, what she was trying to prevent with the gloves, she brought all that in, because in our minds, we're used to gloves, and it provides that false sense of security. But in this case, didn't do anything for her. The key is still hand washing. Hand washing is still the most important key to this. So I know some people are saying, I'm going to make my employees wear gloves so they don't have to hand wash. And I would actually challenge you to think differently about that. Hand washing, hand sanitizing still is a better option. Now, for people handling money, for people who have to wear gloves in their normal job, completely understand that. And here you have a guide as to how to take on and off your gloves. These are, by the way, are tear outs. So you can place them all up in your places of business. You don't have to worry about any signage because we got it covered for you. Hope that helped. All right. Sorry, struggling to find my, that's interesting. Okay, welcoming employees back. So this is after you've done all your deep cleaning and all that stuff, welcoming them back is also critical. One thing I'll say about this is you really want to make sure that when you welcome them back, you understand what they're going through, right? This is not just, hey, come back and work hard. This is show empathy towards what they've gone through, the financial situation, the anxiety of being home, the anxiety of being around family members. Maybe they haven't been around in a long time. There's a lot of anxiety right now. And so you have to sympathize with them. And then there's some people who don't want to come back, right? They're nervous about coming back to work. In that instance, by the way, what we do here at Spectrum, if people don't want to come back to work because they don't feel safe, by the way, physicians, APPs, myself, PAs, we're in the same boat. Even though we're medically trained, we're still scared because of everything we hear on the media, right? We allow these employees 3 days. We educate them about what COVID is, what it isn't. We give them 3 days and we empathize with what they're going through. We try to be here for them as human beings. And then we say, okay, after 3 days, we really need you to come back to work. And then at that point, we have to decide, are we going to part ways or not? Just a little tip here for you. So the key to this is welcoming you back. Here I have your daily symptom checker. That's just a little green check mark. As you can see here, we talked about that. Hand washing. Here's all of our printouts that you can use. So you can take all of our printouts, you print them out basically in different languages. You can post them up on all the different walls that you have. All of it's taken care of for you, again, for free. Community service for you. Mental health. Mental health is a big thing. Mental health is the #1 diagnosis right now, and I just touched on it a little bit, but anxiety and depression, 2 diagnoses that we have. And so we have a free mental health wellness support hotline you can see there. Again, it's in your playbook. Last thing I want to say on this slide is that you have to think about employees who are at risk. I talked about the racial disparities, right, with African Americans and Latino. But people with diabetes, asthma, COPD, autoimmune disease, obesity, older than 65 or other chronic health conditions, you want to maybe make exceptions for them. A lot of the companies that we've been working with, we'll go visit their site and we'll come up with different areas where we can kind of isolate different employees that maybe are higher risk, or have them come in earlier prior to the normal shift opening. Or try and see if they can work from home, those types of things. Here's more tips here for you. Screening and testing hotline, all that information's on there. You can see links to the CDC website. Remember, if you are COVID positive, So if you have an employee who's COVID positive, the CDC wants you to stay home 10 days or 72 hours fever-free, whichever is longest. And why that's important is if you have a COVID positive patient who has been sitting at home for 9 days and then spikes a fever, then they have to wait at least 72 hours before they can return to work. And by the way, retesting is not required per the CDC. I want you to understand that, right? It's not required. So, and the other thing I'll say is this: for asymptomatic folks, let's just say, for example, I like to use examples. Let's just say that Sherry is positive, right? She's COVID positive, and Sherry and I work very close together. What's going to happen is that the health department is going to contact me and say, hey, you have been in contact with a person who's close to you who is COVID positive, and you need to go home right now for 14 days and stay quarantined essentially for 14 days. And this is, by the way, for non-essential businesses. Now, the issue with that is that many of these employees are asymptomatic, right? And yes, the disease spreads fast, but is there a way that we could test employees that are asymptomatic to get them back to work faster? And that's our whole testing strategy that we're doing. We're going from 1,000 to 4,000 tests per day. And we want to be able to test those people who are asymptomatic who've been exposed. And the CDC has guidelines right now that says 2 tests, 24 hours apart, we can get people back to work sooner. So just something to think about that we're doing here at Spectrum is that we're breaking out a large testing component to this so that we can get, again, West Michigan and Michigan in general back to work sooner. There's ongoing support, tools, and resources. All of the links that are there for you. I want to point out up here the Right Place PPE guide, and that guide is there for you to get any kind of resources that you need. And there's the appendix. So I'm going to pause there. Again, the appendix just has all of our cutouts there for you. I will pause there and I will take questions.
Yeah. So I'm going to start off with a few as we let people go ahead and use that Q&A box. If you guys don't know where it's at, it should be at the bottom of your screen. And go right ahead and shoot any questions over that you have. But we do have some already in there and from prior to the webinar because we sent those out. So I will start with those. Thank you for a great presentation. And I might mention too that you mentioned contact tracing a little bit. If any of you guys do have questions on that, Keith, as obviously, but I have volunteered to be a contact tracer for Kent County. So I'm actually doing that work. I may not be able to answer your questions, but I might be able to. So if you have a question on our contact tracing that's going on in Kent County, feel free to shoot a question about that too. And doing that in my free time. And that's been interesting to be a part of that. A question for me. Let's start with a question for me because you mentioned, I kind of missed it. The CDC does not require that you test negative before you go back to work, but you guys are doing that or you're not doing that at Spectrum? You're doing it.
Good question.
Yeah.
Yeah, the CDC does not require that. We at Spectrum, because we are healthcare, we're not doing that either. But where testing can come into play here is when the CDC recommends that people stay off for 2 weeks. That can cripple a business, right? 2 weeks after going through the stay-at-home order already. So our stance now is for our employers out there is that now we are ramping up testing capabilities where instead of staying off 2 weeks, we can do testing for you and get you back in 48 hours versus 2 weeks. That can save a business right there. And that's the key of what our strategy is to, again, like I keep saying, you guys were here for us and now we want to be here for you to keep your business up and running.
So to be clear, there is enough testing to ask your employee to do that and they would be able to get that at this point?
Yes, great question.
Right.
In the early days, there wasn't. We had 100 tests a day, right? Now we're doing 1,000 tests a day. What we're doing though is we're partnering with businesses. So for example, business I was on site yesterday, we're partnering with them to do Nares testing. So what that means is basically they're going to have test kits on site of their facility, and then we would train them how to do the Nares testing. They would actually do essentially like this, like a Zoom call with us, where then we would witness the test itself, and then we were figuring out a way to actually like label that test, and then that test would get to our lab. Probably the employer would actually take it to our lab, and we would run it for them, again, so that we can get employees back, as opposed to just going home for 14 days, even though you don't have COVID. So that's kind of our strategy that we're doing right now. Hope that helps.
That is really helpful, because I was telling you before the webinar started that we're busy writing our back to work policy right now. And that was one of the things that I wanted to ask for, was that negative test back, and kind of wrote, if that's not available, then 3 days post symptom, because that's what I heard. But it's really difficult. I'm, you know, as someone who runs a small business, we're a nonprofit, so I'm not a business owner, but I run a small business. And so it's really challenging, just from my perspective, with just a staff of 5, of the responsibilities that we have as employers, and the constantly changing rules, and knowing what's available in the testing. So exactly how to do that. So let's see. I have a question from Eddie Tadlock with Van Andel and DeVos, and he's wondering if you could kindly briefly lay out, or some way lay out, the testing locations that are out there for us right now.
Yeah, great question. So our main testing location is at 1300 Michigan downtown, and if you drive past it, it's a medical office building, but it has 2 parking lots, and we have 3 tents going. So the way the process works basically is that you would call our screening line, you get an order, and then you get an appointment, essentially. You stay in your car, you drive in, there's a quick registration. You were told to drive in then to tent 1, 2, or 3. You drive in, it literally takes about 3 to 5 minutes, and you stay in your car the whole time. It's very easy to do. So that's our main testing location. That's the nasopharyngeal swab. So just to be clear, for anybody who's symptomatic, we still want to use that nasopharyngeal swab, that most sensitive test. It's for the asymptomatic folks, that the ones that are questionable though, because they've been around COVID, we're using the Nares test. Okay, so I just want to make sure that that's very clear to everybody. Aside from 1300 Michigan Street, downtown Grand Rapids, all of our hospitals have testing capabilities. They're usually run. We actually had tents set up outside the EDs. We've taken the tents down. It's just you show up to the ED, and then they can test you there. Now, of course, when you go to the ED, what does that mean? That means higher charges, right? Because the emergency department, you know, in healthcare, you have to staff that 24/7, have expertise there, and that costs money, and therefore the charges are up higher. So again, it's much better, if you can, to wait and call our OcHealth hotline there, as I've talked about, and get into one of our testing tents, or if we're doing some on-site testing for you, we can do it on-site for you.
That makes sense. So we got a question from an anonymous person, and it says, so from what I understand, you said that COVID positive people can go back to work and continue interacting with others. I'm thinking that you might have said that they have to test negative, or is there different rules at Spectrum because they're frontline workers? I think I know that as a contact tracer, that if I'm calling someone and telling them to stay home for 14 days, if they're frontline, they actually go back to work, not stay home.
Yeah, that's right. So great question, great clarifying question and statement, I should say, but let me clarify even further. And you're exactly right. There's a pathway for essential, and there's a pathway for non-essential. And the pathway for essential means that basically it goes by symptoms for the most part. If I am positive, so I'm a healthcare worker, right? And I'm in contact with patients every day. If I am positive, I have to go home for 10 days or fever-free for 72 hours. I do not have to get retested. I just have to be symptom-free to come back to work, okay? So that's the essential track if I'm a positive COVID patient. Now, also on the essential track, let's just say again that Sherry is working in my same healthcare institute, right? We're good friends, right? We're working close together, right? She's positive. I am then contact traced, and they say, you know, you work with somebody who's been positive. What they would ask me is, are you symptomatic? And I would say, no, I'm not symptomatic. And they'd say, okay, you're fine to go to work. Okay, so that's the essential pathway. The non-essential pathway, and again, you can argue who's essential and who's not essential. I think we all think we're essential, right? That's also controversial. But that non-essential pathway basically is this. If you are a person who comes into contact in that same scenario where, you know, if Sherry's positive and we work at some non-essential business together now, if Sherry's positive, they would call me and they would say, because I've come into contact with Sherry, I have to go home for 14 days. No ifs, ands, or buts, right? And we're trying to say, no, we actually have new testing capabilities, because these rules were written before testing capabilities were where they are now. We have new testing capabilities where we can get people in faster. Now, what's the governing body for all of you? The governing body is MIOSHA, right? MIOSHA is the governing body that they will come in and they'll shut you down if they think you're doing anything, you know, bad in their deemed in their eyes. I've had conversations with MIOSHA and I said, what is your stance on this? If we have new testing capabilities, can we test and get people back to work sooner? And what they reference to me is that they don't have a strong stance on it at MIOSHA yet, but that they're trying to follow the CDC guidelines to a T. In the CDC guidelines, it does say for non-essential that if you have come into contact with a COVID positive patient, you can have 2 tests done 24 hours apart. And if you have that done and they're both negative, you can come back to work. And so I hope that clears up the 2 pathways, because again, we're doing a lot of Nares testing for these asymptomatic people at employers to get them back to work quicker than the 14 days. Hope that makes sense.
That's great news, because at this point, per county, I'm still telling people to stay home, and I'm not even telling them that there is the opportunity to be tested. And I'm issuing them notes for their employers to stay home. And right. I mean, I'm thinking as I'm saying it, how hard that must be for some people. So I've only been doing this for a couple days, and I only do it, you know, twice a week. So we'll see as the rules changes, and so far nobody has said anything to me like, I can't do that. Are you crazy? Right. I feel fine. I'm going to work. And if they do say that, I'm supposed to tell the county that, but essentially it's not illegal. So it's kind of interesting. And I think that having the testing available, being able to say to them, go get a test, will be a whole lot better than trying to say, don't go to work for 14 days, because even I feel bad saying it, you know?
Yes. Yeah, great point. And just one other thing to mention, the question is around, okay, if you're asymptomatic, who pays for the test, right? So let's talk about that for a second. If you're asymptomatic, and this is in fact, I guess it's been longer than 10 minutes ago, like an hour ago, I just heard from a couple payers who are saying it this way. If you're symptomatic, they will pay for it. If you're asymptomatic, it becomes like an occupational health issue, right? Where the business then has to cover it. But then I'm hearing that the state might cover that expense. So there is there's some things still swirling about who's actually going to cover that asymptomatic test. But a lot of our businesses are covering that expense, first and foremost, and then hoping that the state will reimburse them in the future for the asymptomatic. So I bring it up because what I don't want to happen is that person were to call our regular SH hotline, our regular one, not our occupational health, but our regular one, try to get tested if they're asymptomatic, because we're going to tell them no. You really got to call that OC Health hotline so that we can kind of sift through some of that and try and hook up with the business leader to say, hey, we can do a test on your employees here, but you're probably going to foot that bill in the beginning anyways.
Yeah.
Hope that makes sense.
Yeah, that's good to know. And actually at the $85, I think you said, it might be worth it, right? To keep your employees working, because without them, you're not creating any revenue.
Correct.
So yeah. Okay. So I got a couple questions here about PPE. I got a question from Drew Ross with DTE, who says, what PPE are we responsible for to provide our guests? And I also have one, I may as well ask you these both at the same time, from Chris Brummel about face shields and if they're an acceptable alternative to face masks.
Great questions. So the first question, I think it was whose responsibility is it for the PPE for guests, correct?
Well, they're asking if you're responsible for PPE for guests, and I'm not sure there's rules about that, but.
Yeah, that's good to point out. There are no rules about it, but what I would say is most companies that we have visited, they are always offering us masks. Now we bring our own. Like, in fact, I have this N95 mask because I work at the 1300 testing tent.
Lucky dog.
Yeah, right.
Right.
So I bring my own, but just yesterday when we were on site, that the company had their own PPE. Again, you want to do everything in your power to protect your employees, and you can't leave that up to everyone else. They might bring in masks that don't fit them properly, so it's always better to kind of have your own equipment that you've vetted, that you feel like is the right equipment. That's the first one. And what was the second question again, Sherry?
Second question was whether face shields are an acceptable alternative to face masks.
Yep, great question. So the answer is no, but here's where face shields come into play. Face shields come into play because if you think about it, you have and I'm new to glasses. I'm getting older, I guess. You have your mask on, right? And then you have your safety goggles on. And what's happening is, this mask, when you breathe, it will cause the goggles to fog up. In those cases, we do recommend face shields. And by the way, there are in our playbook, there are links to face shields that are shatterproof, which I know is very important for a lot of you in your worlds. So that's my answer on the shields. So utilize the shields more in replacement of the goggles, not necessarily in replacement of the face mask itself.
Perfect. So Andy Mayville from the People's Church is wondering your view on the contactless thermometers. Are they good? Are they reliable?
Yeah, good question. Tough for me to say each individual thermometer and whether or not they're good. I can say, however, that we do recommend like the contactless thermometers if you can get them. We've had trouble getting them ourselves. We were doing a lot of temperature checks with businesses in the early days of this. But yes, if you can get them, they are good. Of course, your environment probably predicts a lot. I should say probably affects that more than anything. In the early days, we were doing temp checks outside, couldn't keep the thermometers warm. It wasn't really that effective. But yes, if you have access to them, we do feel like they're pretty good. Just making sure you're reading those directions about how far you should be is probably the biggest key to it.
So Lindsay Webb asks, testing for a current COVID-19 infection only gives results as of that moment and that day you were tested. What is the value in testing only twice? Is there a frequency that you recommend as an ongoing effort against these asymptomatic transmissions?
Man, that so far that takes the king on the questions. All great questions, by the way. And she's right. Let's talk about that for a second. When you get a COVID test, it really is a snapshot in time. It means at that moment, you don't have COVID. I told an employer before, he told me, I want to spend $20,000 on testing. And I said, you know what? Good for you. I said, it's probably going to be a $20,000 waste of money if you want this to last beyond 24 hours. And he said to me, Keith, I hear you, but he said, you have to understand, my employees are so scared to come back to work, and I want to give them every possible layer of protection. So because he was just starting up, coming back to work, I want to make sure baseline that all my employees are tested, so I know from the get-go, are they positive or are they not? That's the first thing. The second thing is for his employees just to feel safe. The third thing is what we worked out with that particular employer, and we're doing this with other employers, is every 2 weeks doing like some type of a spot check, like Nares Tests. That's probably what we consider to be our latest evidence. But again, she's right. Testing is a small part of the bigger picture. So you can't just do testing alone and think that you're in the clear, right? It's the social distancing, the hand washing, the face mask, the gloves, all that stuff in addition to the testing. It's another layer, another component that can help you. And in this case, again, I think where testing comes into play is getting people back to work faster than what the CDC guidelines recommend with those 2 negative tests. That's a great question, though.
Yeah, so many layers to this.
Yep.
So another anonymous question, is daily health questionnaire a requirement, or in a small business trust, it's 5 to 10 employees to self-report? So I think the question is if you're a small business, then, well, I don't know that it's a daily health questionnaire is a requirement for any size business, is it?
It is not. Well, at least not that I'm aware of, unless something has changed in the last hour or so.
Right.
Yeah, it's not a requirement. And then the second part of that is, remember the daily checker, the symptom checker, it is a self-attestation, right? So I can lie if I want to, and people probably do. But for a business, it will help you. It reminds everybody again of the times that we're in. It reminds them to be cognizant of their symptoms, and it makes everybody feel safe. So like when I come into Spectrum every day, I flash my green checker. Like if I go to the hospital, I flash my green check mark, which means I'm self-attesting that I'm not ill. And so that's really what it's for. It really is a self-attestation. So for a small business, can you just kind of like trust your employees without doing the symptom checker? Absolutely, you could. Depends on who you work with. But for larger companies, I don't know the person next door all the time that I'm working around, and just having that green check does help.
Yeah. Can people voluntarily get tested without their employer asking them?
That's a good question. Never been asked that one before. Could they get voluntary testing without the employer knowing? Correct? That's the question?
Without their employer asking them to.
Yes. So first thing is, if you're symptomatic, absolutely you can get tested. I can test you today, in fact. If you're asymptomatic, that's where it becomes a little bit tricky, because we have to figure out if you're going to pay for it and how that would work. But if you are symptomatic, absolutely you can. And then let's talk about the employer side of this. Remember, in public health times, in this pandemic, we do share results with the employer, because that employer needs to know who's positive, who's not. So a lot of the HIPAA laws have relaxed as a result of this pandemic. So keep that in mind. That's important to know. I won't mention the name. We had a big outbreak in one of our local plants here, and I was able to share with them basically the list of employees who we tested, and it was over 250, the list of positives and the list of negatives. Now, of course, when we're talking to the employees, we always want to try to do our best to not share who is positive and who's negative. But in a public health crisis like this, we have to have that ability to know where to put people. So just realize that a lot of those HIPAA laws have relaxed.
Yeah, I noticed that too in the contact monitoring, that when I call someone to let them know that they've been exposed, normally they already know who the person is. They've already told them, right?
Yeah.
But I can tell them. I actually do have that on this paper, and I can tell them who has exposed them, which kind of surprised me. But yeah, they do. That is part of we're authorized, I guess, or the health system is authorized to do that because of it, because this is a health crisis, a public health emergency.
Right.
So, yeah. Boy, this is a something. And okay, Garrett, can you speak more to the looming second wave come fall? Do you think the fall wave will be worse? And are we better equipped to handle a second wave now after learning from the first wave?
Great, another great, man, you guys are great questions. I won't say that I can tell you that there's going to be a second wave. What I can say is we're concerned about a second wave, absolutely. That's first and foremost. Secondly, we are definitely better equipped to treat this disease now than we were back in March. And I say that every single day here at Spectrum, we have what we call grand rounds. And in those grand rounds, we have all of our clinical experts, and they talk about our COVID cases and what we're seeing. I mentioned to you about the hypercoagulable state, right? We didn't know that back in early March. We now know that. We now know we have to treat them differently with higher volumes of blood thinners than what we used to. So we are absolutely more equipped to deal with this. I do think, I mean, you can never predict, but I don't suspect, even if you look at the Spanish flu back in the day, I believe that the first peak of the Spanish flu was very large and the second peak was smaller. I believe so. And so I would expect something that could resemble that. I'm not saying that we're going to have a second surge. I'm just saying that if we, I think people keep saying the word relax. Oh, we're going to relax everything. It's not about relaxing. It's about going back to work and opening up in a different way than what we had pre-COVID. So just keep that in mind.
Right. If we want to stay outside of our homes, we have to be extra careful, not spread the disease so that we can keep operating our businesses and seeing our families.
That's right. That's right.
So we're just 3 minutes to go here. The last one's more of a statement than a question. And so I'll read that and then I'll start wrapping things up. But this comes from someone on the east side of the state. And they love what's going on here and said that you're making them want to move to Grand Rapids. They're wondering if you know if the hospital systems have similar resources on the east side of the state as what we're offering here, as what Spectrum's offering.
Well, that's another good question. And thank you for the statement. We'd love to have you. And by the way, I said earlier, I love Detroit. I love visiting it. I miss it every day. What I'll say is, Detroit, if you saw those initial slides, they've been in the thick of it in terms of their surge. And so I think they're more in scramble mode trying to treat patients. We've been in real preparation mode, right? So I can't speak to what resources they have that are like this or not. So I wish I had a better answer for you. But certainly, if they want to reach out to me and ask me any other questions, I certainly can.
Great. So you're gonna have to make me the host again, or wait.
Oh.
I bet you I can stop you from being the host. So let's see here. How do I do that? I don't know. Let's see, make me the host.
I'm gonna try and do it myself.
Host disabled attendee screen sharing. Yeah, I did that, okay. But I don't know how. Okay, so we might not have our last slide because I can't figure it out. Most of you who've been on our other webinars know that Jillian, our program manager, is our normal web host, and she had a family emergency, so I stepped in today. And I just want to thank you, Keith, for all this information. Really great. Thank you to Spectrum Health for being there for us. Thank you to everyone that was on the phone today. Our sponsors, DTE Consumers, Eagle, and the Weggy Foundation for making these webinars possible. And I wanted to point out that our next webinar is on bipolar ionization. This is by viewer's choice. You guys really wanted to know more about this technology, and we're going to talk about it next Monday on May 28th at 10 a.m. And directly after this webinar, you'll be receiving a link. You'll get the recording, the presentation, remind me what your packet's called, the back to work. No, Keith?
It's now an employer guide.
Employer guide, and that looks really helpful. I know I was working on our back to work strategies and our policy last night, and it was overwhelming, so I can't wait to take a look at that. We have a survey at the end of this that will flash on the screen. Please take that for us. Let us know what we're doing right, what we're doing wrong, and what else we can do for you. So thanks again, Keith. Keep up the great work. Have a good day and have a good Memorial Day weekend for everybody.
Yeah. Thank you all.
Bye-bye.
Stay safe.